so much for this topic. When I came back into the industry in 2017, one of the ills that I saw was the rampant presence of silo pharmacies, independent pharmacies, all across Nigeria. On one hand, we didn't have enough pharmacies because ideally we should have about 200,000 pharmacies serving the population. But on the other hand, the few pharmacies that we did have then, about 5,000, were underserving the people and were more or less struggling to survive. It was an anomaly. It was an anomaly because ideally when you have low supply, you should have high demand and you should be overwhelmed with demand. But that was not the case and still isn't the case. There are other several reports that say we have 6,000, we have 8,000, but it's still not enough. So when I set up an online pharmacy, it was to help to bridge a gap in access to affordable and genuine medicines because of an existing silo problem. Independent pharmacies were rampant, and you could find them individually struggling with the commonalities of issues across the country. Access to the right people, access to skills, access to markets, access to resources. Almost every pharmacy could recount to you the same issues. If you go to the medical field, almost every clinic could recount to you similar issues. If you go to the primary health centers, similar issues. So it is obvious that our smallness does not serve anyone. It does not serve the operators, nor does it help us to serve people better. You know, in the past, when doctors worked with their portfolio or with their briefcase and they went house to house, it served the purpose of intimate care. So you could call on a doctor, come to your home, see you, give you that care, and would remember you and have your preferential treatment and all of that. It no longer serves us to work individually in that manner. We now need skill because guess what? Not only is Nigeria highly and densely populated now, but from all projections, by the year 2050, our population would make us the third most populated country in the whole world. And we will need to solve for obesity in 2050, for diabetes in 2050. We need to solve for high blood pressure and all sorts of chronic illnesses that are creeping into our population now. Now that we're about 200, 220, 230, then we will be about 400 million, and we need to start to solve for scale. We need to understand that what is working now cannot sustain us in the next 15 years. So when I'm talking about 2050, it isn't so far off. 2050 is just 25 years away. So the children that will be 30, that will be 28, they're already born. They're already existing. And to care for them and those that will come after them, we need to ramp up skill. Working in silos has not served. If you look at countries that are like us, and I like the studies that have been done by the Big Four, where they first identified, helped countries to identify who their peers were. There's one, I think was done by, it leaves me now, BSG or BPGS or so. A study was done that listed the N11 countries. Nigeria is one of them. Vietnam is one of them. Mexico is one of them. So they were the N11 after the initial original BRICS countries. South Africa joined the BRICS, so it became BRICS, and then N11. If you want to compare yourself to countries, then pick that list and say, what happens in Mexico? In Mexico, you see a chain of pharmacies having 5,000 branches. In Nigeria, and as I speak to you today, the figures are out there for you to check. The largest chain of pharmacies in Nigeria is not up to 200 branches. Yet, efficiencies happen when you run chains. Why? Because you can bulk purchase, you can negotiate, you can deploy to technology systems, and it will have higher impact. You can deploy one solution maybe to address pregnant women, and you can deploy it in all the branches. There's uniformity of practice, there's standard operating procedures, there are quality measurements that will have widespread impact. But if you choose to do it in 200 branches, you have to contend with 200 owners, and you have to contend with 200 different sets of ethos and value systems. We cannot progress working alone. We cannot. And so we need to build the skills to expand our healthcare system beyond silos. We need to move from silos to systems. Now, moving from the traditional healthcare system to now see the players that have said, all right, we understand that to leapfrog, we need to embrace technology. Therefore, we can bring in some digital solutions. But even then, as digital providers, we find ourselves working in solo systems, working by ourselves, isolated, insulated, and not connected. It does not serve anybody. It does not serve. You might have a flutist that is remarkable, that is incredible, that is award-winning, but have you heard the power of an orchestra when they play beautifully in symphony, where the flutist, the celloist, all of them know their time, they know their tune, they carry the song, and ultimately you have a performance. That's where we should be going in Africa. Gone are the days when we could say one big, strong company, one big man. You know, we come from the historical, what we've inherited historically has been strong kings, strong queens. You know, one Queen Amina of King Jaja of Opobo, and so on and so forth. That no longer serves, because we saw the cracks that happened when people came in to colonize us. They could colonize us because we were separate and we were not a formidable, united people. If you want to cause change to happen, you must think in terms of systems. Systems build. When we build too much around people, it has the inherent tendency to fail and crack and be subject to weaknesses attached to the person. But when we build around systems, not only are they reproducible, not only are they replicable in other environments, they are more sustainable, meaning they can withstand the heat, they can withstand the pressures that come with just living. Africa, not just Nigeria, Africa has gone through tumultuous changes in the past few years. You look at the economy in Kenya, in South Africa, in Nigeria, in Ghana, even in Egypt and so on, we've got a nosedive of the valuation of our currency. We have a lot of exodus of our experts because we're largely English speaking, at least the countries I have mentioned. So the English speaking West has found a place where they can quickly and rapidly take a lot of professionals, and many of you have demonstrated that on this call. So what we're building here that was meant to serve us and was not enough is easy pick for those other countries that can take away. So there's been an exodus of expertise, an exodus and a weakening of our systems here, and Africa still has to survive. Our 1.3, 1.4 billion population is the youngest population in the whole world. The impact for me of that sort of population is that when the world around us is aging and getting weaker, we have to block the gaps that come from their aging population, and we in this continent therefore need to produce value. We need to be able to show we can carry the whole world and take it to the next level and not take it down. So Africa has a strategic role to play. We cannot continue to be the poor cousins. We cannot continue to be behind when things are being discussed as though we have no part to play. We cannot continue to be, not be reckoned with when decisions are being made for the next 30 years. Because in the next 25 years will be the most populous, Nigeria at least, the most populous country in Africa. We are in Africa, but the third most populous country in the world. In the world. It's about time that our healthcare system can serve us and serve other continents. So this is not just about, Nigeria should be good, let's even build for Africa. We need to begin to think of the implications of an aging population all around us, and we are a young population. That means we need to feed the world. And in feeding, I'm not talking about just agriculture. I'm talking about a workforce that has to serve the world. So we need to build with that in mind. So many solutions, of course, naturally start with sparks of ideas from individuals, but it doesn't have to stay like that. We've seen the weaknesses of building around individuals. We must build around systems. Yes, it's beautiful that we've been celebrating our startup landscape, our ecosystem across the Digital Health Africa. This is the 2023 landscape check that was done. You can see how we've categorized ourselves into verticals, diagnostics, telehealth. I hope you can all see. Can you wave? Okay, great. So we've done analytics, we've done all the health financing guys. We've done, I think we sit nicely in the pharmacy aspect. We sit, the supply chain and logistics. In reality, several of us play across different verticals, but that's not even the point. How well are these individual entities that are in the landscape able to withstand the wind, the rain, the heat that is in the land? How well are we scaling? Are we reckoned with on a global scale? I mean, it's beautiful to be able to say, we showed up in the African landscape. Are we showing up in the global landscape? Hardly. Very few of us showed up in 2023 and they've gone under. Examples like 4G. Some of us were not existing in 2023, are now existing, but are struggling to raise funding to take us to the growth phase that we need. Some of us then were doing one thing or the other in 2023, have had to pivot to do something else in 2025 just to survive. I read a report recently that said if you started off 2015, 2017, by now on the average as a company in digital health in Africa, you should be doing a revenue volume of about 3 million. Many, many, many of us do much less than $1 million. But they compare that $3 million on the average for an 8-year-old, 8-year-old, 9-year-old company to the average across the world in the West, which is about 8 million. So we're still far behind in terms of what we're producing, in terms of the impact of our value to the world. And then now we're being told that, our solutions are basic and even simple. They're not, in quotes, innovative. Now, there are many discussions you can have about that. One could say, well, what we need in our own reality in Africa are really basic infrastructure changes and things that we even, first of all, even take health rural, or take it to the gentleman in the marketplace, or take it to the woman that is struggling with her. So we do need basic solutions. But gone are the days when those arguments lead us to the front. Now there are prototypes of robots or agents that can swallow pills, and their internal environment mimics my internal environment, such that when that robot or that entity takes the pills and the side effects show up in that entity, they can know from a personalized medical care perspective that I would have the same side effects. Therefore, they can avoid that in my care. We're still very far away from such levels of care. We still use AI in rudimentary ways, and we need to begin to use it in more impactful ways to become less dependent on outside Africa for our drugs. So we need to use AI for medication discovery, for medication development, for medication production, for medication testing, and then ultimately for effective distribution across the world. We are sitting in a jungle as solutions to chronic care issues that the world has struggled with for decades, for centuries. But if you look at our history, you find people who can swear to having taken some leaves mixed with something and rubbed in some sweat, and then you lick it and the disease goes. But where are the studies that were done, are being done now to show the authenticity of that solution, to show the validity and reproducibility of that concoction, and to show the safety margins of using that contribution to healthcare? Doesn't exist. We can accelerate such with AI. So I love the landscape. I'm an advocate of the landscape. I'm a proponent of working amongst ourselves. But for too long, we have celebrated and over-celebrated our to move up, move higher, rise up to the next 3, 4, 5 levels that will make us be reckoned with on a global basis. Yes, digital health is a great enabler in the delivery of healthcare services, and it will help us to get to the overall objectives of universal health coverage, which are availability of the healthcare, availability and accessibility, accessibility, and affordability, because it might be accessible, it might be available, but not affordable. But in all of this, with equity. I would have liked to add quality. That's fine. Now, collaboration for me is, however, an angle that we have under-emphasized. Leapfrogging is essential. Digital health is essential. We can make impact if we keep at it. But to actually get further, go through the minor steps, the minute steps, the minor steps that others went through. We must jump ahead. And we've seen it happen in financial services sector. Africa at the time was leading with all of the innovation around SMS banking, mobile banking. We've done quite a lot that the West had to learn from us to use. There were when if you did a transaction in our fintech or in our banks, you got your deposit the same day, you got your credit the same day, the transaction happened. In the US, it took 3, 4, 5 days. Not sure how fast it is there now. With solid solutions around security in cybersecurity. So for me, we can do it. We have precedent to show other sectors in our Africa have leapfrogged. So there's nothing to hold us back. There's no inferiority complex for us to embrace and romance. We can move forward. I think each one of us here at this meeting begins to think, because we're not of an underage cadre. Many of the people who are leapfrogging and doing fantastic, awesome things are as articulate as we are. They are as confident as we are, educated as we are. We need to embrace some maybe additional. Internet and various parties now are committed to enabling us to get that level of exposure. Now, rub that exposure with your competence, your intellect, your emotional stability, and you can find that you can do all the leapfrogging needed. I have just a few minutes left, but I want to just share some examples that come to mind of how we have, tried to embrace partnerships and collaboration, and choose 1, 2, or multiple forms, to get things done. For example, we partnered with the regulator of pharmacy practice when we said, look, we need to help to solve a problem that we were seeing with interns in pharmacy. We were losing them rapidly. So each school of pharmacy, but they were leaving the sector into other sectors or leaving the country and not even carrying out their full internship. Or some needed to carry out the internship attachment, but they were waiting 2, 3 years because there was a particular organization they wanted to work with. So we set up the pharmacies, to help to stimulate the mindset of a set of pharmacists every year for them to see themselves as solutions providers, more enabled, more confident to take on what is needed in the workforce. And we're seeing a lot of results of many staying in pharmacy or checking out of the country, but staying within pharmacy, still adding value, mixing product development, mixing health financing, mixing health economics, mixing various things with pharmacy, so not jettisoning it, thinking of it as an inferior course, but now understanding how they can annex, multiple. So PLSP is an example. I call on many of you to see how you can collaborate with the regulators. There are many challenges regulators have. They have limited resources. So if you can do anything with them, beautiful. You can partner also with Big Pharma or the original equipment manufacturers or donor agencies like we have done with Bayer. Bayer is a German company. We collaborated with their foundation, and even now we're exploring collaboration with the pharma company itself. Associations also can be powerful collaborators. When we aggregated 1,000 pharmacies across Nigeria, it was the first of its kind. They had not heard that, so I had to become sort of an evangelist, going from zone, going from meeting to meeting, going from, and so on, preaching the message of collaboration. The result was overwhelming. Almost 1,000 pharmacies agreed to work together to solve access to market, access to resources, and access to skills issues that we elaborated. So ACPN, PN, these are associations that you can work with. I'm sure in the medical field, I'm sure in the nursing field, in physiotherapy, you can work with them and get things done. We can have partnerships with intra-industry entities or inter-industry. And the point is identify, go to that landscape that I just showed you, pick up someone that you know that if I should give them my own value proposition, they probably need it, and we can work together to solve the ultimate problem, which is access, affordability, accessibility, and equity of healthcare to the last mile. And then you can find individuals. And there was a program that I helped to reignite at University of Lagos College of Medicine called STARK, or was it STARK or STARK? And I got them to say, you know what, let's have a pitching, program where each medical doctor or pharmacist or anyone from the medical field gets someone from law, from technology, from economics, from HR, wherever, you collaborate, form a team, and come up with a healthcare solution. It was wonderfully, accepted because I thought, look, let's rub minds together with others. Let's see what other sectors are doing. Find someone in entertainment and see how your health education and their own perspective to music, drama, or any form of entertainment can marry, and you can advance health promotion and health prevention. You do know now the work that Apoko does is not pure medicine that is taught in school. He has combined his learnings from other fields. He has been an actor, he's been a skit maker, he's this and that. He's combining that to find solutions to tell people how to prevent or promote things. You can find someone in rehabilitation. You can find someone for restoration and so many other aspects. So treatment is not the only aspect of healthcare that we need to look at. And we've been doing all of this in AHA. We have multi-stakeholder program right now running in Kaduna that's got 5 partners, 2 of us in healthcare, 3 in agri. And we've combined our skills, our leeway there, and it's running. What we're doing is a 3-year program that's funded to the tune of to get medicines and other healthcare products to the last mile for at least 500,000 households in Kaduna State. And it's running, it's working. And we're not doing it solo. We've combined our forces with Jennifer Eti Foundation, Healthy Entrepreneurs, Effects for Healthcare, and Koamana, and we're running it beautifully. So there are various things you can do. You must think out of the box. You must bring your solutions, promote it, propose it, think through what are the ways we can collaborate so that we can aim for skill and not just keep patting ourselves on the back doing small things. Small things have paid us in the past, but they're no longer where we should stay. If you've been playing small and you want to scale, I think a veritable way is to leverage the existing parties that are there who are doing fantastic work. It's not for you to come to say, oh, they've been doing rubbish, to criticize them and try to jettison them. This is where we do co-opetition, where we collaborate with our competitors. Because when you collaborate with competitors, you both be because the market is out there and you're both not reaching the full market. But when you join forces, now you can scale. You can make yourself partnership ready by lowering some human egotistical standards that are not paying off for you, but you need to just, remove them from the equation and be more open to say, this is my own strength that this is your own strength that you bring to the table, and we do not feel threatened by our strong personalities. Instead, we see that this person can advance, he can plant, I can water, and we can see growth. That's where we need you to begin to think. But when everything is about you, the founder, it's counterproductive in the long run. So let's have mutual benefits as each one of us is delivering value as an innovator. Each one of us is intentional about fostering partnerships. Each one of us has seen the light that running solo is not the way we will solve for Africa, that Africa has to serve the world. Each one of us can understand that we must integrate, we must collaborate for scale. That's when we can attract the right funding. We can get the grants, get the loans, get all that is needed, get the people to work with us, get expertise, get the government to bend to our will because they can see our value that we bring to the table. I hope that this is helpful. Ginger some of your thoughts around moving from silos to systems. Thank you very much.